Hello, my name is Lakin Zolman and I'm a student physical therapist. Today I'm going to show you how to correctly don and doff PPE in the hospital setting. If your patient is under droplet precautions, airborne precautions, or contact precautions, it is important to know how to wear PPE to protect yourself as well as the patient. Here I have a gown, gloves, and a surgical mask. First, no matter the precaution, you should always have a new set of gloves when seeing your patient. When your patient is under droplet precautions, you'll want to protect yourself from any fluids in the air that could come into contact with you. You will require to wear the gown, the gloves, and the surgical mask. If the patient is under contact precautions, you're required to wear the gown as well as the gloves. Though the surgical mask is not required, it always adds an additional safety measure, so it's never a bad idea. If your patient is under airborne precautions, you will be required to wear a special mask called the N95 to further protect yourself. When putting on PPE, you will want to start from biggest to small before you enter the room. So I will start with the gown, and then I will put on the gloves, and then the surgical mask. First, I'm going to pick up the gown by only touching the side that will come in contact with my body. As I put on the sleeves, I'm still only touching the inside of the gown. When tying the neck and waist ties on the gown, I want to make sure the ties are behind me, so when I go to take off the gown, the ties will have the least amount of contact with the patient as possible. This gown does not have thumb holes, but many do to ensure that your sleeves will stay down. When putting on my gloves, since these do not have the thumb holes, I have to tuck the sleeves of the gown into my gloves to ensure the least amount of skin exposure. For the last step, I have to put on the mask. Here, you want to only grab the elastic bands and hook them behind your ears. Make sure you spread the mask out and pinch at the nose to close off any germs that could get in. After correctly putting on my PPE, I can now go about treatment with the patient safely. At the end of treatment, I want to take off my PPE before I exit the room to make sure I am not carrying out any germs with me. First, I will remove the gloves, then the gown, and then the mask. First, I'm going to take off my gloves by using the outside of one glove to turn the other glove inside out while taking it off. With my clean hand, I'm going to use the clean side of this glove to grab the other glove and pull it off inside out again. Removing the gloves with this technique, make sure I haven't touched anything contaminated. Next, I will remove the gown by ripping the strings behind my waist and neck. Once the ties are ripped, I'll take my hand from inside the gown and down the arm to remove it and turn it inside out. Then I will do the same with the other sleeve to make sure I am not coming into contact with the dirty side. Lastly, I am taking off the mask by grabbing the elastic bands from back and disposing of it. Once I dispose of everything correctly and wash my hands, I am ready to go treat other patients. Wearing PPE correctly is the easiest way to protect patients, yourself, and others in the hospital. Remember, and above all else, safety first.